We are pleased to share that this closing keynote session is sponsored by the network of the National Library of Medicine All of Us Community Engagement Center. We are grateful for the NNLM All of Us Center's keynote sponsorship and their strong commitment to health literacy and health equity. Wisconsin Health Literacy has been honored to be a partner with them over the years, and we are excited to promote how they engage a broad spectrum of the community in science and research practices. Brittany Thomas, Associate Director at the Network of the National Library of Medicine All of Us Community Engagement Center, is here to share a few words about their work before we reveal the mystery speaker. Please welcome Brittany.
Thank you, and you're welcome for not being the mystery speaker. I promise I'm not it. Okay, so I am here to share a little bit about the network of the National Library of Medicine and specifically our work in partnership with the NIH's All of Us research program. So first, the network of the National Library of Medicine is the outreach and engagement arm of the National Library of Medicine, which is part of the National Institutes of Health and is the world's largest biomedical library. The mission of the network, or as we so lovingly call NNLM, is twofold. First, to advance the progress of medicine and improve public health by providing all U.S. health professionals with equal access to biomedical information. And second, and honestly more importantly, I think within this context, it's to improve the public's access to information to enable them to make informed decisions about their health. We do this by working through libraries and other members of our very large 8,000 plus organization network to offer training on biomedical and health information resources to improve health literacy and to increase health equity through information. NNLM has also been a partner of the NIH's All of Us research program since 2017, bringing awareness of the importance of diverse participation in biomedical research to communities who have been historically underrepresented. We promote health literacy, digital literacy, and research literacy as essential tools for participating in research and in supporting their community's health through community science. A little bit more about All of Us. The All of Us research program is a historic longitudinal effort to gather data from 1 million or more people living in the United States to accelerate research and improve health. By taking into account individual differences in lifestyle, socioeconomics, environment, and biology, the program hopes that researchers will one day uncover paths towards delivering precision medicine or individualized prevention, treatment, and care for all of us. So now that we're at the end of this amazing summit, and after listening to some fantastic and inspiring presentations, I can safely say that the core values of All of Us fit perfectly within the focus of the summit and with the mission that brings us all here. For example, the program is actively ensuring participation reflects the rich diversity of the United States. They treat participants as partners and ensure that they have access to their own information. The program values earning trust through transparency and strives to ensure that the data they collect can be accessed broadly for research, including by the participants themselves. And ultimately, they want the program to become a catalyst for positive change in research that supports health equity and social justice for everyone. So NNLM supports All of Us by offering funding, training, virtual programs, and other resources for libraries and other community-based organizations to further individual and communities' health, build and strengthen partnerships with communities who are underrepresented in biomedical research, and to raise awareness of All of Us across the country. No matter where in the United States you live or what organization you're with, there are always opportunities to get involved in the health of your community through NNLM and our partnership with All of Us. And I didn't tell anyone I was doing this, but NNLM peeps, please raise your hand. I know you're all here. There's a ton of us. A couple over here, one over there, one over there. If you haven't had a chance to talk to one of these amazing people, please do. They represent 7 regional medical libraries based all across the United States and access to wonderful resources, training, and funding. So please, before the end of this, we've got an hour, and then after that, grab someone and chat, because we would really love to talk to you about how you could take advantage and become involved within the NNLM, and especially our work with the All of Us research program. Thank you.
All right. In this era of fake news and ill-informed influencers, effective science communication is vital for maintaining public trust. Our mystery keynote speaker has spent the last decade learning how to be a better communicator. That's including tweeting and blogging, as well as working with artists, animators, and illustrators. In her presentation, she will talk about the journey to becoming an engaged and trusted public communicator of science. She'll also reflect on the good, the bad, and the ugly of communicating science during the pandemic. Also known as the pink-haired science lady, Associate Professor Susie Wiles heads up the bioluminescent superbugs lab at the University of Auckland, where she and her team are on the hunt for new antibiotics. Dr. Wiles firmly believes that science communication is an integral part of the research process and has received many awards for her efforts, including the New Zealand Prime Minister's Science Communication Prize. In 2019, she was appointed a member of New Zealand's Order of Merit for services to microbiology and science communication. When the pandemic arrived, Dr. Wiles joined forces with spin-off cartoonist Toby Morris to make the science of the pandemic clear and understandable. Their award-winning graphics have been translated into multiple languages and adapted by governments and organizations around the world. Dr. Wiles was named as one of the BBC's 100 most influential women of 2020 and Kiwi Bank's New Zealander of the Year in 2021. And she's coming to us today from New Zealand because of travel restrictions. We couldn't bring her, so we had to bring her in virtually. And a fun fact about Susie is that she's obsessed with Legos. And now I'll turn it over to Dr. Wiles. Thank you.
Thank you so much for the invitation to speak, and I'm sorry that that I'm beaming into you from the future actually. So here it's Thursday morning. So yes, good afternoon to you all. So let me just share my screen for a minute. Hopefully you'll be able to see this, and then I can get started. So you're probably all wondering, I know it was a big mystery reveal, who the hell is this woman? So you may well know me from some of the work that we did a couple of years ago now. If you remember the whole flatten the curve craze that went on at the very beginning of the pandemic. So that was work that was done by myself with this cartoonist, Toby Morris. And it really kind of, I guess it took us by surprise how crazy that graphic went. But I think the highlight for us was when our Prime Minister used it in one of her stand-ups, media stand-ups, to talk about why New Zealand was going to do what we ended up doing. So as Stan says, I'm going to give a little bit of a kind of a talk about my journey to being a sort of science communicator, I guess, a little bit about what I've learned during the pandemic, and then really some kind of key messages for, I think, the way that we need to kind of communicate going forward. And it was really wonderful actually to hear who the sponsor for the session is, because I feel like everything that I've learned and that we're doing really is reflected by the kinds of programs that the sponsor is doing. So I guess I'm going to show you what some of that looks like in practice. So just a really little bit about me. So as Stan said, I head up the bioluminescent superbugs lab. Basically, all that is a really fancy way of saying that we make nasty bacteria glow in the dark. And the reason that we do that is because they only glow when they're alive. And we basically then have a really easy way of saying, you know, are our bacteria dead or alive? Where are they? And we use that to try and help us find new antibiotics. Because I know we're all worried about a viral pandemic right now, but actually there are other infectious diseases that are just as big as issue, kind of bubbling underneath the surface. So I'm an active scientist, I'm a university lecturer, but as a scientist who's kind of publicly funded, I've long been interested in science communication. And one of the reasons is because the public fund our work either through their taxes or through donations. And so I firmly believe they have a right to know what we do with their money. So for me, I started more than a decade ago learning how to become a better communicator, because when you're communicating to your peers, certainly, you know, using the format of peer-reviewed publications, it's a very, very different format to how you would communicate to non-scientists. So as you've heard, I'm a kind of tweeter, a blogger. Really, my journey started with blogging. And so I started blogging on a site called SciBlogs, which is run by our Science Media Center here. And my blog is called Infectious Thoughts. And the idea was just to write about a kind of microbiology related story every week. I used to do a post called Monday Micro. And so I was following things like outbreaks or writing about interesting microbiology papers that I was reading. And then in about 2010, there was a massive outbreak of a nasty E. coli disease in Germany. And so I did what I always did, which was to start writing about this. In fact, it's something that is really interesting to me because I work on a related organism. And actually, the first post I wrote about it was that this bacterium can get inside of vegetable leaves. And so it doesn't matter if you wash your vegetables, if the bacteria is inside, you can still get this form of food poisoning. Anyway, it was through this writing about this that when the story broke in New Zealand and journalists were looking for a scientist to talk to about it, the Science Media Centre said, well, Susie Wiles is a microbiologist and she's been writing about this for a few weeks. And so I ended up doing my first ever kind of live TV interview, and I was absolutely terrified. But I obviously did okay, and then ended up doing more and more media. And then was asked to become the science commentator for one of our national radio stations called RNZ. And so I still have that today. Every fortnight, I get sort of 10 minutes to talk about 3 science stories that I find kind of interesting. And I've tried to use this as a way also to talk about how science is done. You know, what kind of experiments do people do? What's the process like? Instead of just here's the highlights, here's the what's going to cause cancer or not cause cancer. How do people actually find this stuff out? Through that, I moved then into working with an animator called Luke Harris, who is an Australian. And what I was trying to do here, this was kind of as videos were starting to appear on YouTube. And I really wanted to learn how to tell a science story kind of as an elevator pitch, I guess. And so, you know, this was all about learning how do you put something complex into under 2 minutes, and then pair the wording with these sort of beautiful graphics. And so we did a whole bunch of videos now that were all about taking a creature that glows, so fireflies or whatever, and then linking those animals to the use of light in science. And so this is just showing you a still from our animation that was about fireflies and showing how NASA used the firefly reaction to search for extraterrestrial life. And what was really cool was this one got selected to show at the Imagine Science Film Festival in New York. Alas, I didn't get to go to New York then either, but I did finally get to go and see the fireflies for real a few years ago, which was amazing. So through all of that, I ended up winning this really cool prize from the Prime Minister, which then gave me some money to actually do something. And with that, I ended up working with my daughter Eve and making a little show about microbiology for kids. And the idea was that she was the one kind of going on this journey. I was her kind of sidekick, and we would go and kind of talk to scientists. I guess my favorite episode is the one where we swabbed our belly buttons and our toes for bacteria, and then we used them to make cheese. We went to a cheese maker. And so that was to talk about microbiology in food, but also to reveal this kind of interesting fact that one of the reasons why some cheeses smell like sweaty feet, or some sweaty feet smell like cheese, is because the same bacteria that are used in cheese making also grow between some people's toes. So that was kind of an amazing sort of experience, you know, getting to learn how to communicate science with children sort of through my daughter. And then a few years ago, I ended up writing a short book about antibiotic resistance, which is my kind of real kind of research passion. So I've kind of learned, everything has been about learning how to communicate with different audiences in sort of different ways. And it's not something I recommend every scientist do, but I've just kind of have a very short attention span, I guess we can say. And as you heard, kind of all of that culminated in me being made a member of the New Zealand Order of Merit. And what I guess I want to show you here is that there's, if you're a sports fan, the same year that I was made a member of the order, we have in the middle here Dan Carter, who is one of our retired All Blacks, so a rugby star, so huge person in New Zealand who the public love. And this lady here is Lydia Ko, the golfer. So it was kind of really cool as a scientist to be sort of amongst this kind of group. And it was really cool to be recognized in this way for both my science, but also my science communication. And it's not something you know about. People nominate you. So it was the same with New Zealand of the Year. I don't know about these things. People just sort of nominate you, and then you get this weird phone call where you wonder whether you're being pranked at the end. But it wasn't. It turned out, and then I get this nice little rosette that I can wear on my lapel. Anyway, so all of this is a kind of a long-winded way of kind of saying that when the pandemic arrived, I felt like I had been, training basically for a marathon that I didn't know I was going to have to run, right? So when the pandemic arrived, the same thing that always happens when there's some kind of microbiology related story happened, and that's that my phone starts to ring because journalists say, oh, Susie Wiles can explain this to us. So this happened when the Zika virus outbreak happened. I don't remember if everybody remembers that one. The Ebola outbreak from West Africa. So whenever there's something, the journalists call me, and then I just pick up my phone and start. And this one started with, well, we don't really know much about this. Back in mid-January 2020, it was like, this is a kind of watch and see. At the moment, it's not looking so concerning. What was kind of amazing was 2 weeks later, I remember my next interview going, wow, this is escalating fast, right? I mean, it was moving very, very quickly. And I think within a couple of weeks, it was really clear, this to me at least, that what we were going to experience was unlike anything we'd experienced before. Yeah, so as I say, I kind of felt like I'd been training for this marathon, and now here was this culmination of not only my area of expertise as an infectious diseases person, but was going to take all the skills that I had learned over the last 10 years about how to communicate about infectious diseases. So one of the things that really, I guess, for me, really changed how I, well, not changed, but really informed how I approached communicating during the pandemic, was an event that I had been asked to moderate back in 2015. And it was called Small Island Big Ideas. And it's a series of I guess, panel discussions that have been brought together by this really small group that live on an island off the coast of Auckland, where I live. It's a very self-sufficient kind of little island. And they had a group of people who were wanting to put on these events to sort of, get many people on the island to know each other a little bit better, to work together more as a community, because it certainly has some people who go there because they don't ever want to see people again. They want to live off grid and stuff. And so what they chose for that very first event was basically a session on pandemics. And so the premise was, this flu pandemic has swept the world. It's killing people left, right, and center. New Zealand basically decides to shut down, and this Great Barrier Island is kind of left on its own. And so how should the island respond? And so they brought together a virologist, somebody from civil defense, a science fiction writer, and also a sociologist who studies communities who basically are surviving or not disasters. And because of my science communication work, they asked me to moderate the panel. And the question was basically, tell us about viruses. How realistic is this scenario? What should we as a society do if it happens? So I must say, when the pandemic really started to impact us all, I kind of thought back to this event that we'd had 5 years before and thought, gosh, this is quite interesting to reflect back on. And what I really learned during the session actually was through the sociologist, Professor David Johnston. So he, as I say, he studies communities who are experiencing disaster, whether it's floods, earthquakes. And I just remember what he told us about the societies that are basically the ones that come through. And what he said was, those societies that survive the best are those that pull together and work together for the greater good. And he talked a lot about coffee. He said, it's not about hoarding the coffee, it's about making sure everybody has access to the coffee. So what I remembered all this, and then I thought, okay, so the really important things for me as a communicator is to be calm, because when we panic, we do not act in our best interests. I wanted to be transparent and show my workings, right? Show when there were things that we didn't know, but explain what it was that I was going to base my judgment on. I wanted to be accessible to people explain the evidence as we had it, and as I said, also explain what we didn't know, but be practical. So what were the things that people could do in order to feel like they had some ownership or some power, but also to show, I guess, as David explained to us, that it is all about all of us coming together and looking after each other. What was also really important to me was to show my values. And this has become a really important, I guess, thing about how I communicate, is that, we've seen that countries have made different decisions essentially based on the same evidence. And what people need to understand is that it is about values and access to resources and things, right? So you can take the same evidence and come to very different conclusions about how to act based on your values and based on your kind of surroundings. And so I wanted to show what my values were so people would understand why I was making the suggestions I was making. And then as an infectious diseases person, it's really important to me that we don't stigmatize people with infectious diseases. So I wanted to be really careful about the language that I use. And what was really valuable in the early days of the pandemic is the UN and the WHO released a whole bunch of amazing work on how do you speak about something? What's the language that you use in order not to stigmatize? And so I remember taking all that, devouring it and saying, right, this is how we should speak about this. So I was doing kind of interviews with media, and one of the things that I don't like about interviews with media is that, often you've only got a very short period of time. You might only have a minute, or if you're lucky, 2 minutes. And obviously, if you pre-record something, they'll just kind of snip the bits that they want. And so it's very difficult to kind of say anything really. You could, you get high level stuff, but you can't really tell people what you're thinking or what you're basing your judgments on. So I was approached to write for a little media organization here in New Zealand called The Spinoff. So they're entirely online. I'd written with them before in the past, and they said, if there's anything you want to write about COVID, feel free to put it here. And it was great because that gave me a place to really write about, here's what we know, here's what we don't know, here's the links to everything. So people really could see my workings out, right, as to what I was going to say. So I started writing there as well as doing all this other media stuff. And then in February, late February, I saw this graphic shared on Twitter by Drew Harris. So this is one of the original flattening the curve graphics. And what he was explaining was basically how important it was to use protective measures because they would essentially slow down the pandemic and help to keep cases below our capacity to look after people. And I thought this was such an important message that we needed to be talking about. But what really struck me about Drew's graphic is that it didn't really kind of draw me in or capture me. I thought there was a much better way we could communicate it. And it didn't really show the role that we all played in this. So I approached Toby Morris, who's an award-winning cartoonist here in New Zealand, who I've followed for years, and he writes or draws for the Spinoff. What I love about Toby's work is he has a real interest in social justice, has a real interest in inequality, and that comes through in all of his work. So he's done amazing, cartoons about poverty, all sorts of things. And I just thought he would be perfect. He would understand how to make us see how our actions could help with this idea of flattening the curve. So I put a message out to my editor on the Spinoff to say, hey, do you think Toby would be interested in working with me? And within an hour, we were both on the phone. I'd sent him the tweet where I talked him through what I imagined. I was saying, like, it could be this GIF that kind of moves between these sort of two realities. What do you reckon? And then he got to work kind of drawing, really thinking about what colors do we use, all of these kinds of things. And so on the 9th of March, that was when our version of Flatten the Curve was released. And it was basically this toggling between these two realities of like, yeah, whatever, it's just a cold or flu, large number of cases, versus actually don't panic, but be careful. It's kind of interesting looking at it now, really thinking about droplet spread. It was all about don't touch your face, wash your hands, stay home when sick, which is still an important one. And using that, we could, keep cases low. So we released that on Twitter. I wrote about it and put it up on Spinoff, and it went absolutely doolally. It was kind of amazing how many impressions the tweet got, and it just started being picked up all over the place. It was amazing. One of the things that I approached Toby about doing from the very beginning, though, was to release it under a Creative Commons license. So this is, again, kind of openness, transparency is really important to me. But I figured if it was really useful, wouldn't it be amazing if people could adapt it, translate it, use it for their purposes? And a Creative Commons license was kind of a way to be really explicit about that. So Toby knew about Creative Commons licenses, but never really used them. We talked about it, as a creative. For him, I think it was, it was a new idea really to release his baby into the world, saying, yes, please adapt this. But he totally understood why I was pushing for it, and that's what we did. And so we chose this CC BY share alike license. So basically giving people explicit permission to modify, to do whatever they wanted with it, provided they cited us still and they didn't change the license. What's really interesting actually when it took off was that nobody paid attention to that, but it still, people understood and at least did modify it. So as I say, it ended up going a bit crazy, and our Prime Minister used it. There was a guy who ended up making a little program that you could just type in what language you wanted, and then it would basically spit out the version with your language, which was kind of amazing. So it was incredible seeing what people did with it. But within maybe a day of releasing it, I sat back and I was like, oh, actually, no, this is completely the wrong message for the world to get. Because what this is really about is just saying, let's slow down cases so we can still cope with it, but people are still going to get sick. And what we didn't know about then, but what really concerned me at the beginning of the pandemic, was what might the long-term consequences be for people who get sick. And I was thinking of things like, we know that some viruses can cause Guillain-Barré syndrome, which is kind of a neurological disorder. We now know that people with EBV can get multiple sclerosis. So I was really thinking, what might happen with this one? Of course, we all know now, actually, it causes very serious damage in quite a lot of people. So I think it was right to be worried. So we redid the version of the thing. We based it on a paper published in The Lancet by a bunch of very eminent epidemiologists, who basically were arguing for what's now known as the elimination strategy, or zero COVID. So on the 14th of March, we released our next version, which we called Stop the Spread. And the idea now was also to move away from this kind of one person doing something to show a collective response, right? That it was about all of us. So we had this sort of no collective response. We just have this very large wave. If we have this best case scenario, strong collective response of everybody working, we can essentially, get cases down to near zero. But what they warned about in that Lancet paper was if you release those public health measures too soon, you will see cases rise again. And so that's why you need to do these as a long-term, or at least more people doing this a collective response rather than just a small number of people or countries. Otherwise, we end up with these waves. So as I say, we did this, we released it, and nothing happened. We'd missed the boat. Everybody was on to flatten the curve. Very few people were advocating for elimination. And so New Zealand ended up being one of a very small number of countries that took that path. It was hard, I know it would have been hard for lots of other countries, but anyway, that's what we ended up doing. And we've kind of lived, I guess, in a bit of an alternate reality for the last couple of years, which we're now well and firmly out of, and learning what living with COVID really looks like. Anyway, so this, I guess, started this kind of collaboration with Toby. When we released this one, he was like, right, what's next? And so we started basically just making these graphics together. The next one of ours that went viral, pardon the pun, was one where we showed just how exponential spread works, but also how our actions can stop a transmission chain. So this was really just showing how one case, even if it's only got an R naught of 2, very, very quickly becomes an extremely large number of cases. And what we showed, and this very much reflects where New Zealand was at the time, was, you know, working from home, not flying, not going to a barbecue, staying home, showing how you could basically interrupt these transmission chains. And again, so this one went absolutely mad. It actually got taken up by the kind of public health messaging in lots of different countries. And what was really interesting, especially for Toby, I guess, as the artist, was to see how others took his concept and then, you know, almost changed it to match perhaps the personalities of the countries involved. So, for example, here we've got in the middle, we've got Germany, which was all very straight lines. And this is the one in the top corner is Australia. Yeah, so it was really amazing to kind of see this concept that he'd done, then adjusted, you know, and made appropriate for the countries that it was being shared in. And this is the one in the bottom corner is it being displayed on a bus stop in Germany. So it kind of went all over the place, which was kind of amazing. So from there, we must be up at nearly about 50 graphics now. We've done things on explainers on transmission, on vaccination, on how variants arise, on, you know, what are PCR testing, what are antibody testing for, all sorts of things. So we've done ones that really explain the science. But then we've also done some that really were just about helping people think about the concepts, you know, so for example, this was a really great one I loved about the Swiss cheese model. So this idea used in healthcare and aviation that no one measure is enough, that you have to lay, because each one has got holes like a slice of Swiss cheese, and by layering them up, you can make the most protective response. And so this was, you know, adapted from this really important work by a man called James Reason. And so we showed what different countries were doing, what the slices of Swiss cheese looked like. And again, explaining which ones were kind of the responsibilities of government, which ones were the responsibilities of individuals, and how they all sort of work together. What was really cool about this one actually was being contacted by somebody who was involved in the early days, explaining how it got its name, who was the person who actually named it, which was really, really cool. Yeah, so we've done other things other than the kind of science. So this was our alternatives to handshakes, hugs, and high fives. So how do we do greetings when we're trying not to do contact, right? I said, I asked if we could have the Wakanda Forever sign on here, but I ended up being outvoted, and we had a whole bunch of other different ones. But again, this was just something that, you know, would help people understand here's how you can behave during this extraordinary time. And then the other one we did a lot of was explaining this concept that we had here in New Zealand about sticking to your bubble. So this was when we were in our lockdown, and we were basically told to keep to our household. You know, households are complicated. And so the language that our Prime Minister used was calling us bubbles. So stick to your bubble. And it's a great concept. And we ended up showing, you know, how quickly you can pop your bubble, how to stay in your bubble, those kinds of things. So we did a lot of those sorts of graphics, explaining what bubbles looked like in different contexts. So our aim with all of this communication really was to be independent of government. That was very, very important to me. I was approached several times about whether I needed support, and I was just like, I want to be independent. What we really wanted to do was provide information in bite-sized and understandable pieces to make it engaging and shareable. You know, we know that's really important for getting messages across, and to explicitly allow others to modify and translate it. So if it was useful, you know, use it. And we heard back that a lot of our graphics were translated and used in refugee camps and in all sorts of places that we really hadn't expected, I guess. So if you're interested, we have this kind of box set that have been put together up on the Spinoff website, which kind of just puts everything there. I kind of feel like we really need to go back and adjust some of them based now on what we know. What we started doing last year was dating it because things were moving so fast, putting a little date and saying, you know, this is our understanding at the time. Things might change in the next few months, which they very clearly are moving quite fast with the pandemic. I guess what was really unexpected was that the spin-off then got a call from the WHO. So they had, I think people had kept sending our graphics to the WHO saying, these are amazing. And so they ended up contacting the spin-off, and Toby and his team ended up working for them, adapting a lot of our graphics for the WHO. And then making new ones. And so what we ended up doing for a period was we would have, I would really think about, what do we need to know, what do people need to understand. We would develop a graphic, try it out here in New Zealand, and then Toby would pitch it to the WHO. And so it's amazing seeing our work then basically be changed for a global audience and reach millions and millions of people. It's been kind of amazing. I think maybe as a career highlight, a piece I wrote for the spin-off about vaccines has ended up, I was asked to adapt it, and it's now one of the main pages about vaccination on the WHO website. So that's that's cool as a scientist, going, wow, something I wrote is up there on a site that's accessed, as a source of trusted information by so many people. So what are the lessons that I've learned? Gosh, there have been a lot of them. I think the first one has been just the importance of teamwork. The collaboration that I now have with Toby is just the most special, the most productive of my entire working career. And it really has been based on a complete a sort of mutual respect and admiration for each other's work, right? So, as I say, I've long admired Toby and his style. He is the expert here. He had been following my writing, so he, respected me and my values. And it was the coming together of us, as a kind of subject matter expert, and Toby as this incredible communicator, that has sort of made something that I think is better than the sum of it, or the sum of it's two parts. It's made something quite special. And I think what's really important from the scientist perspective is we can often see these kind of collaborations with communicators are often not a collaboration. It's more like a commission. So thinking, I want this person to do something, and you kind of have this really fixed idea in your head of what it looks like. With Toby and I, it was not like that at all. I mean, there were some graphics where I had to kind of like, oh, wouldn't it be cool if it was like this? But as Toby being the graphic communicator, it was entirely, it was up to him really to say, this is actually the best way to do it. And so it wasn't about the science trumping the communication. It was about this kind of coming together on an equal footing. So we're trying to kind of open up spaces for more of this kind of thing. So last year we ran a workshop called Drawing Science, where we brought together scientists and artists and illustrators, and kind of did a sort of speed dating. And really what we're trying to do now is just create a database of both scientists and other researchers really would be better to say, and illustrators and artists who are willing to work together, so that we can see if more of these kinds of partnerships can be sparked. And it's been really cool seeing some of the work that's come out of that workshop. Another thing that I've really learned, I guess, about communicating is that sometimes you have to get really personal. And it's something that we're not really taught to do. In fact, I would say we're probably actively discouraged from doing as scientists, is kind of getting personal, right? There's this idea that we should be honest brokers, that we basically give the science and then we step away. But actually, that's not how people communicate. And one of the things that I found is that actually you need people to know who you are and to know what your experience is and where you're coming from. And so I put this post up as an example because I think this is one of the most successful times I did it. And it was when I was talking or writing about should people get vaccinated if they're pregnant, if they're trying to get pregnant, or if they're breastfeeding? So this was a question I was being asked a lot on social media, by people who are very nervous about that. And I started writing a post about the studies, like, this study saying this and the study saying that. And it didn't work. And so what I decided to do was talk about my journey to becoming a parent. It's been complicated. I have polycystic ovarian syndrome. I have had miscarriage. So what I decided to do was talk about that, because what I wanted people to understand was I knew what they were worried about, right? I know that feeling as a pregnant person or as a new parent, that concern, are you doing the right thing? Are you making the right decision, right? It can be, I mean, it's terrifying. And so that's what I wanted to do. And I basically ended up making this really long post that was incredibly personal, talked about my personal journey so that people could understand that I knew what they were worried about. And this was what the science was saying. And as somebody who understood their worries, this is what I would suggest. And it was incredibly popular. It went really well. And I got so much feedback from it that was what had helped people make their decision. It wasn't just the science, it was getting it from a place that somebody who knew what it was that they were actually concerned about and showed them that. And so I think this has sort of changed, how some of the communication that I do, or how I do some of the communication, is to really think about how do you wrap up the science in a way that people then understand that you do get what it is that they're worried about and what they're asking questions about. The other thing I've learned, and I kind of knew this a little bit as a woman on the internet, but actually is just how hard it can be to be communicating during something that is just this emotive, when we've got people who are actively trying to destroy the public health measures that we know will keep people safe. So this is just the results of a survey that were published by Science, I think just a couple of weeks ago. They surveyed researchers who work on COVID to ask them what harassment they had experienced. And so there was a similar survey done a few months ago by by Nature, and they did it slightly differently. They approached the science media centers to survey the people who were commenting about COVID. And whereas this study looked at who's been publishing about COVID and then asked of their experiences, had they communicated, had they received harassment. So the two studies both found harassment, but they found very different levels of it, because the Science Media Center one found very high levels of harassment, as a percentage of people surveyed. But that's because most of the people, well, everyone who was surveyed was doing science communication work, whereas this science study was only a small portion of this. The researchers were actually communicating publicly about their work. But this shows the kinds of things that they were getting. So personal insults, if we go from the top, attacks on professional capabilities, allegations of dishonesty and corruption, everything right down to, protests outside of their home or work, threats of physical harm, physical intimidation, vandalism of home or property. So basically I have experienced almost all of these. The only ones I haven't had is any suspicious mail. I've had nasty mail, but none of it's been suspicious. I haven't had anybody protesting outside of my home or work yet. All of the wishes of harm have been directed at me and not my family, thank goodness. Actually, I should remove physical intimidation. I have had that. I was approached by an anti-vaxxer when I was having breakfast at a hotel once. I should remove that one. I'd forgotten about that. When the harassment happens every day, you start to forget what it is that you're experiencing. And I put a little kind of unsure bit around vandalism of home and property, because so my home address and my personal phone number are released on nasty bits of the internet on a fairly regular basis now. And to the extent that we've now had security cameras put up to monitor that sort of thing. And I have had somebody come and put some anti-vax stickers on our fence. So is it vandalism? Well, I was able to get them off, but people know where I live. And that's is a concern kind of moving forward. So I guess the reason for bringing this up is I think that if people are going to communicate, you have to go into it knowing what might happen. And there are things that we can do, right, to try and protect people. I think I've learned a huge amount having had nothing in place. I know what I would do now to try and de-escalate some of these things, things about taking our personal details off the internet, all of those kinds of things. So it's something, this harassment is something that people need to know about, I think, before they go into this, to make sure that they have the support around them to continue. Okay, the other thing that I really learned is about the use of trusted voices. So what's really, really clear is that, people, different communities, different groups trust different people. And the research around vaccination actually is really clear that people are most likely to have their minds changed by the people who they trust, right? So if they are distrustful of authority, then you really don't want authority giving out the messages because they won't trust them. So we actually put in a grant application to try and look at this. It was rejected, so we ended up kind of doing this project in a slightly different way. But it came about because of Twitter, actually. So there's this amazing lady called Tina Nata. She's essentially an Indigenous and human rights activist, really interested in the environment and various things like that. She lives in a part of New Zealand that is incredibly remote. So her community does not have a pharmacy, does not have a doctor. They only have a nurse. They are about a 5-hour ambulance drive away from the nearest hospital. So I've shown you the location of their community here. So New Zealand is an archipelago with 2 main islands, and they live right here in this little area here. As I say, it's about 5-hour drive away from hospital help. It's very, very remote, very rural. So Tina reached out basically to say that, she wanted to know more information about vaccination so that the community could decide, was this, what was going on with COVID? How would they protect themselves as a community? They are very distrustful of government because of bad experiences that they've had. So they want to know what the information is, and they want to kind of make the decisions for themselves. And so what we ended up doing was myself, a Maori doctor, somebody who's a specialist in disinformation and misinformation. We went to visit this community. So Maori people have there's a real protocol around how they welcome people and all these kinds of things. So we did what's called a pōwhiri, which basically welcomes somebody into their space. And then we had essentially a community meeting where we were just available to answer anybody's questions. And then the next day, so we actually stayed there for a weekend. The kids from the local school came to talk to us, and we talked about, what vaccines were and what viruses were and various things like that. And talk to the trusted people in their community who would be the ones who were communicating to other members of the community. So it was all about making sure that those trusted voices in that community had the information they needed to be able to convey and package, I guess, in a way that worked for that community. So we did that. We've been available on tap. If there's anything they ever wanted to know, we were just available to them to answer questions. But essentially what happened after we left is the community then basically started talking about, okay, what did they want to do about vaccination? Was there something that they wanted the entire community to be vaccinated? How were they going to encourage that to happen? One of the really interesting things when we did when we had the school children come and see us, they came voluntarily. So the time we were there, it was terrible, terrible weather. And the school had no electricity. The storm had cut the power out. And so the teacher knew that we were in the marae, their meeting house, for the day, talking to people. And so she said to the kids, I'm going to go and talk to those people we met last night. You can all go home if you want, or you could come with me to the marae and talk to them as well. And the kids all decided they would come and talk to us. And so what we ended up doing to them was sort of, explaining what vaccines were and everything, and then saying to them, hey, so, if this was something that would save, somebody's life, who is the person in your life that you would want to be saved, and why? And so and why don't you make a poster about this? And so it was just amazing, because what the kids came up with were things like, well, I want my granddad to live, because if he dies, who's going to fix my bicycle, or who's going to, and it was really interesting seeing their insights into who was important to them and why they were important to them. And so they ended up making these little posters that they could then take home and talk to their family about what they'd learned about vaccination and why it's going to be really important to them that this person in their life got vaccinated. So they ended up then making a whole bunch of incredible resources for Māori communities. They decided to call themselves an immunity community. That was kind of their way of framing it. And they made all these resources, which they then put online, not only to share with their own community, but with other Māori communities around New Zealand. It was bilingual, so in both English and what we call Te Reo Māori, so in the Māori language, and has been, a really effective way of this community engaging with other communities to say, this is what we've learned, this is what we believe, so, how about you all get on board? And what was really amazing was that last week they were announced as the New Zealand Community of the Year at the New Zealander of the Year Awards. So this, the way that they've taken this on and made this, something for them has been absolutely incredible, and a real learning for us as experts that at times you are not the right person, right? You're not the right person to deliver the message. So you just need to be able to play your role, which may well be a backstage role, and you enable the community to do what's right for them. So my take-home messages really are, it takes a team. So, find the trusted people who, who you work well with, I guess, to deliver these messages in ways that are appropriate for others. And I think with communication, it really is about, getting in touch with the people who are really expert communicators. And I think, one thing we really have to remember is that the people who spread disinformation and misinformation, they know this, right? And so they create information in ways that is designed to be spread really well over social media. And they use the frames of fear and all that kind of stuff. So we don't want to do that, but we do need to learn the lessons and figure out how we can, work against that. And I think it definitely takes teamwork. And then the last thing is to find the trusted voices. So who are the communities that you want to, to talk to? Who are their trusted voices? And that's who you work with, and allow them to develop the resources that are right for them. So with that, I'm going to end. I hope that we're going to be able to show the little TV ad that they ended up making, which then showed on TV in New Zealand, which I think really beautifully sums up what being an immunity community meant for them, and why they were trying to encourage others to take that same, route and get vaccinated. And with that, I will stop sharing my screen, and thank you all for your attention.
Thank you, Susie. Can you hear me?
Yes, I can hear you.
All righty. Let me, I didn't have that queued up. I apologize, but I can get that queued up. But why don't we take a quick question from the audience, and I'm just going to have to repeat it up here so that Susie can hear it. But we have time to take one question while I'm getting that video ready. We've got a big group here, Susie, today, so we've got to walk across the room.
My question is, how did you go about honing your communication? Was it kind of trial by fire? You just started blogging and paid attention to what worked, or did you take classes or talk to other communication experts? How did you hone your communication skills?
Did you hear that?
So basically, how did I do it? Was it like, did I take classes and things? Was that?
Well, how did you hone the messaging?
Yeah. So what's kind of really interesting as a science communicator, right, is that there are practitioners and then there are people who study this as a research area. And my experience has been that these two groups just don't meet together, right? The practitioners are not reading the research, and the researchers are not talking to the practitioners. They're kind of doing sort of studies and stuff. So I have been a practitioner. I haven't really engaged with the research in that area. I'm now working with people who do that research. And actually what they've said to me is that I've basically instinctively learned what the research says is the stuff that works. And I guess that's through, when you do talks, you can see with engagement, right, what ends up being posted and stuff. But when you do talks and things, you watch body language, right? You watch what works and what doesn't work. And so I think for me, it hasn't been reading the papers. Frankly, I find it hard enough to keep up with the papers in my actual research area, never mind all of this other stuff. But it has been through, through kind of instinct or the subtle cues that people give you when to find out sort of what works. And so I guess I've been really really fortunate in that it has worked, but also listening to people. Like, for example, the thing that I did with David, learning about how should we be, what's the thing that people can need to know, how do they need to behave, and then thinking as a human being, well, what would make me behave that way, what would make me feel like that. So there's been a lot of kind of personal stuff, and I'm becoming much more what we call reflexive. So working with these researchers who study science communication, they're just getting me to think about things more, to stop at the end of an activity and go, okay, so what did you want to achieve from that? What did you achieve it? How did it make you feel? What would you do differently, rather than just sort of launching into the next bit. Although I have to say, during the pandemic, there has been no time for reflection, right? When Toby and I were at our most productive, we were bashing stuff out in like hours. And so there was no time to go, okay, sort of test that. But we would get feedback, right? So I remember one graphic that we did, which was trying to explain some of the terms. So, for example, elimination. So explaining what the epidemiological meaning was versus what people understood from kind of everyday use. So we did a graphic like that, and I remember one of the words that we used, a scientist was like, no, that's the wrong one, and so some of our graphics we ended up just redoing if they weren't quite right. But again, Toby has had this again, more than a decade of that kind of graphics experience. So I think a lot of it has just sort of been what we have learned almost through doing.
All right. Well, I don't have that video ready, but what we'll do is we've got a follow-up email that's going to come to everybody, so we'll be sure to include that video link so you can see it. But we have time to take one more question. So let's take one more question. All right. And I'll repeat it for you, Susie.
Hi, thank you. I just was kind of curious, as someone from the outside, being in New Zealand, looking in at the United States and sort of what our experience has been here with the amount of division and misinformation and all of that, if you can kind of comment on some of the missteps or some of the sort of lessons learned coming from your perspective in New Zealand.
Yeah, gosh. Well, you've obviously been a main manufacturer of disinformation that's then spread all over the world. And part of that is having platforms essentially based out of the US that just are a law unto themselves, right? Facebook, all of those kinds of things. And people are doing incredible work to try to say, look, we have to regulate this in some way, right? So there's that thing. But actually, so really quite early on in the pandemic, when everyone was looking at China and at Italy, I wrote a post saying basically which was the country that worried me the most, and it was the USA. And so cases were very, very low. I think this was maybe only a week or so after your first cases had been announced. And I said, this is the country that really worries me. And it worries me for several reasons, one of which is the lack of kind of socialized healthcare. I was really worried about what that was going to do. When you need a response, that it doesn't matter who you are or how much money you've got, you need to be looked after. And you need to be able to stay home if you're sick, right? And so the kind of lack of sick leave and all those kinds of things really worried me. And you obviously had Trump in power as well. But I honestly did not anticipate it going as badly as it did. And I think the fact that it fell on kind of political lines, that you essentially have had a group of people who have actively pushed the removal of public health, public health measures that actually work, has just been astonishing. But I think the thing that astonished me the most was finding out that Trump and his entourage were basically stopping things like PPE and, we're stealing stuff from the States, that we're selling it. I just found that kind of like, oh my God. So I think what everybody has learned during the pandemic, that things like socialized healthcare, that caring for each other actually is really important. And New Zealand has been massively attacked for the approach that we took, because it showed that a liberal democracy could do it, that we could do something. You can do extraordinary things that we would never have guessed would be able to be do, like lock down a country, stop all flights. A country that isn't reliant on tourism said no tourism for 2 years, right? It was kind of extraordinary. And yet we didn't need police on the streets. We did it because of this kind of collective, we need to look after each other. And so we've been roundly attacked by people who don't want that kind of world, right? Who are sort of a more libertarian bent, each for their own. And so I think that's the reflections that we need to have as a world, is actually what kind of world do we want? And unfortunately, there are those who just it's all about money and all about individual choice, but all our choices have consequences, right? And what we've shown you during the pandemic has been that actually, if we work together, again, exactly what that research shows around communities and earthquakes and stuff, we will have a better response. But I don't know how you fix it, right? When you've got such active, people in power who are lying, and people vote for them. I mean, it just makes me despair, I guess. Which is why my approach is then just to go, well, what can I do in my little area? Like, how can I just try and explain things? Because I think, honestly, if I, otherwise I just wouldn't get out of bed in the morning, frankly.
Alrighty.
And I really feel for you all. I mean, this is, moving forward, this is really, really hard. I'm from the UK. My parents are in the UK. They've stopped free testing. I mean, cases just go nuts. My mum's got a blood cancer. That means that she would die if she got COVID. So she's been in isolation for 2 years. It's like, how are people supposed to live now, right? They've got to take their life in their hands every time they go out. Yet we know that there are things that we could do, masks, all these sorts of things that would keep people safe. It's just, yeah. Anyway, yes.
Thank you, Susie, so much. We really appreciate you.
Thank you so much, and yeah, thank you for having me. And I hope it wasn't too much of a disappointment who the mystery speaker was.
No, thank you. All right, you ready, Michelle? We'll do our closing comments now. Thank you so much, Dr. Wiles.
Thank you. It's amazing what a New Zealander can teach us in Wisconsin about cheese, right? Stinky cheese, Swiss cheese. But I think the most thing that I'm going to take away is what her points to be calm, transparent, accessible, and make sure that everybody has access to all the coffee. I love that. Explain the evidence, be practical, show your values, and do not stigmatize. Those are great things to take away. I hope that you can all find a nugget of truth in that and think about that a little bit more. I would just like to thank our sponsors again. We wouldn't be here without them for sure. Our presenters who taught us so much, the poster presenters, DHS again for making sure that some of the presentations will be recorded and sent to you later. That should be about 4 to 6 weeks. The PowerPoints, again, they're on your app. If you go to the schedule and you pick your session, you go down to the bottom, you can find in a PDF form the PowerPoint slides. And you can also hit the 3 dots above and send them to your email if you like. But we will also share the PowerPoints in PDF format. We'll give you access to a link where you can get all of them. That will take us probably a couple weeks yet to get that out to you. Evaluations, please, we really rely on your comments and thoughts to make this conference better. So please share those with us. Again, practice your digital skills and scan, or again, use your app to fill out the evaluations. It's really helpful. You can return name tags and programs if you're not going to do anything with them at the desk. for continuing education credits for people looking at that. Right outside this door on the registration table, there are 2 forms, one for pharmacists and one for other CEUs. Just, there's an access code if you're gonna apply for your credits. Take a picture of that form on your phone so you'll have your access code, or there's also a QR code to use again. So, and I think that's it. We are all really privileged to be here. I want to thank you for your patience and learning again or relearning what it's like to be in a group. I know that all of us took risk to be here together. And while it's a privilege, I also feel it carries a responsibility. So I hope that what you learned here gives you an opportunity to think about how you will take that out to better the lives of the people you serve. There's a lot of work to be done. So thank you so much for investing these 3 days or 2 days with us. We really appreciate it. And safe travels home.